Welcome. You have been scheduled for a procedure with me, Dr. Ruan Louw, and my team. Although we have not been able to meet in person yet, I'm sure you probably have a lot of questions. I hope that this short video will help you understand a bit more about your condition as well as your upcoming procedure. So let's delve into some of the basics as to how our most precious organ, the heart, works. The heart has 4 chambers. The top 2 chambers are known as the atria. The bottom 2 chambers are known as the ventricles. The heart beats as a result of an electrical wave that moves through the heart. Under normal circumstances, a heartbeat occurs as a result of an electrical impulse that is generated by your natural pacemaker cells. These pacemaker cells are located in the right atrium. Each electrical impulse creates an electrical wave that moves through the atria. This electrical wave activates the atria to contract and squeeze blood through valves into the ventricles. The electrical wave then travels to the ventricles down a main nerve that connects the atria to the ventricles. This nerve is known as the AV node. The electrical wave then reaches the ventricles, thereby activating them to contract and pump blood to the lungs and the body. Atrial fibrillation is usually caused by multiple abnormal electrical impulses that originate from specific areas in the left atrium. These electrical impulses occur in rapid succession and create multiple little waves, similar to a handful of pebbles dropping into the heart's pool of water. These disorganized ripples overwhelm the atria and cause the atria to quiver or fibrillate, thus the term atrial fibrillation. Atrial fibrillation affects the body in 3 ways. First of all, the quivering of fibrillation of the atria prevents them from contracting. The atria are no longer able to squeeze blood into the ventricles. The ventricles in turn receive and pump less blood with each heartbeat. This results in less oxygen-filled blood circulating to the body, causing symptoms such as persistent fatigue, difficulty in breathing, and impaired ability to perform exercise. Secondly, many of these disorganized ripples in the atria find their way to the ventricles via the AV node, activating the ventricles in a rapid, chaotic fashion. The rapid, irregular beating of the ventricles cause a fast and irregular pulse. Some patients may be aware of an irregular beating of the heart, a sensation referred to as palpitations. Thirdly, the loss of atrial pumping results in slowing of blood flow through the atria, increasing the risk of blood clot formation. When these clots dislodge, they may end up being pumped to the brain, causing a stroke. Atrial fibrillation occurs as a result of 2 main factors: wear and tear, as well as your genetic blueprint. Wear and tear may be increased by factors such as age, obesity, chronic heart conditions, high blood pressure, and sleep-related breathing abnormalities. Your genetic makeup affects the specific way your heart cells communicate with one another, making some people more susceptible to developing atrial fibrillation. We aim to achieve 2 goals when we decide to treat patients with atrial fibrillation. Firstly, reduce the risk of stroke with the use of blood-thinning medication, and secondly, improve your quality of life. Since most individuals with atrial fibrillation have an impaired quality of life due to lack of energy, difficulty in breathing or palpitations, treating the atrial fibrillation often results in improvement of these symptoms. Treatment options include lifestyle changes, medication, and a procedure known as an ablation. Lifestyle changes include losing weight, exercise, reducing alcohol consumption, and treatment of conditions such as sleep apnea. Medication may be appropriate for some patients, but unfortunately has a few drawbacks. Firstly, it is relatively ineffective at eliminating symptoms related to atrial fibrillation in most patients. Secondly, it may cause side effects such as fatigue, a slow heart rate, low blood pressure, weight gain, and in some instances of long-term use may cause organ damage, leading to thyroid function abnormalities, impaired vision, skin rashes, sunburn, and rarely lung damage. You have probably been scheduled for an ablation procedure. A cardiac ablation is a minimally invasive procedure where energy in the form of tiny little burns, freezes, or electrical impulses are applied to regions within the heart. Catheters that look similar to spaghetti strings are passed via small tubes the size of straws placed in the groin vein. The catheters are then advanced inside the vein up to the heart. The energy delivered via these catheters reduces the ability of small areas of heart tissue to conduct electricity. For the treatment of atrial fibrillation, these applications of energy encircle the regions where the atrial fibrillation originates from, thereby electrically isolating the problematic tissue from the rest of the heart. Ablation therapy affords numerous advantages over the use of medication. Ablation therapy is much more effective in improving symptoms related to atrial fibrillation and may in some cases result in cure. The need for chronic medication is also often reduced and in some cases completely eliminated. Ablation therapy reduces the risk of heart failure, stroke, and dementia as compared to patients that do not undergo ablation. Importantly, the ablation procedure is generally more successful the earlier it is performed after the onset of the atrial fibrillation. If the atrial fibrillation is left untreated for too long, it may become impossible to normalize. Research studies have shown other benefits related to ablation therapy, such as reducing the risk of dementia and stroke. Even though the ablation procedure is minimally invasive with limited recovery time, there are some risks involved. The most notable complications include significant narrowing of a lung vein, also known as pulmonary vein stenosis, which occurs in less than 1% of patients, inadvertent puncture of the heart that may require surgical treatment, which occurs in less than 0.1% of patients, and injury of the esophagus resulting in a connection between the atrium and the esophagus, also known as an atrioesophageal fistula. But this is very rare and occurs in less than 0.1% of patients. Minor complications include post-procedural chest pain due to inflammation, also known as pericarditis, which may occur in 1% of patients, and severe groin bruising, known as hematoma, in less than 1% of patients. The benefits of undergoing the procedure significantly outweigh the risks in the majority of patients. So, what can you expect with the procedure? You will be admitted on the day of the procedure and usually be able to go home the following morning. You should not stop any of your usual medication prior to the procedure, including blood thinning medication. Although you will be able to walk and perform normal daily tasks after being discharged, you may feel tired for a few days after the procedure. Exercise should be avoided for 2 weeks after the procedure. Although we have performed thousands of procedures similar to the one you are about to undergo, we realize this may be your first time. Seeing familiar faces on the day of the procedure may help you feel more at ease. My team and I look forward to helping you. See you soon.